In a world where your health care can be reduced to numbers, one miscalculation can cost you everything. You don't need a scalpel to cut off care. Just an algorithm trained on biased data and programmed to save money more than it saves lives. This isn't a glitch. It's the perfect crime committed by code. For decades, medicine was personal. A doctor's judgment, a patient's story. But then came the data revolution, promising to make healthcare faster, smarter, and fairer. Billions were spent building predictive systems, programs designed to find out who's sick, who's high risk, and who needs help the most. But when these systems learn from a biased past, they start repeating the same old biased past. In 2019, a major algorithm used by hospitals nationwide was exposed. Its purpose? To predict which patients needed extra care for chronic conditions. Its flaw? It used past healthcare costs as a stand-in for health. Black patients historically have been undertreated, underinsured, and spent less. So the algorithm decided they were healthier. Same illness, different color, different outcome. The algorithm touched more than 200 million lives, controlling access to care, management programs, specialist referrals, and even life-saving interventions. Hospitals relied on it to save money. Insurers used it to deny coverage. And nobody noticed the racial gap until it was too late. When you use money as the measure of need, the poor will always look healthy. Healthcare is now run by thousands of invisible algorithms. They determine your premiums, your prescriptions, and your pain level. Some even flag when patients might be drug seeking. with Black patients 30% more likely to be marked high risk for abuse. In 2020, research found facial recognition tools failed to read darker skin tones appropriately, leading to faulty patient ID systems and diagnostic errors. In the digital hospital, discrimination does not wear a coat. It hides in the code. For every biased line of code, there's a body behind it. Studies show Black women are 3 times more likely to die from pregnancy-related causes. But the AI systems monitoring maternal risk often ignore social determinants, income, neighborhood, stress, and label them all as outliers. See, when the system decides who's worth saving, inequality becomes policy. Behind every algorithm is a contract. And behind every contract is a profit motive. The healthcare data analytics industry is worth over $100 billion, built on personal information harvested from hospitals, pharmacies, and insurance claims. Every denial, every delayed treatment, every misdiagnosis is someone's balance sheet improving. This isn't medicine gone wrong. It's medicine optimized for money. But the heist did not go unnoticed. In 2023, regulators began pushing for algorithmic transparency, demanding audits, fairness tests, and accountability. Researchers are now developing equity-focused models that weigh community need, not just cost. Because if bias can be programmed, justice can be coded back. For all its promises, artificial intelligence has become the new gatekeeper of life and death. A system that decides who gets care and who does not, often without a human ever knowing. The algorithm doesn't need to hate you. It just needs to learn from someone who did hate you. They call it innovation. We call it what it is: theft of care, theft of trust, and theft of life itself. The data doesn't lie. It just hides the truth. This is coded to die. Another chapter in the Money Heist files.